Let's talk about the treatment for insulin-dependent diabetes mellitus, also referred to as type 1 diabetes mellitus. Insulin is the treatment for type 1 diabetes mellitus. This is because these patients do not produce their own insulin. They also try to decrease the amount of carbohydrates or sugar that is in their diet. Insulin schedules range from simple to complex, and they're designed around the ability and the willingness for compliance. A simple insulin schedule is a daily dose of lenti or long-acting insulin. A moderate schedule is a twice-a-day dose of Humulin N or intermediate-acting insulin. Complex insulin schedules include checking the blood sugar before meals and at bedtime and giving regular or Humalog insulin based on the blood sugar level. Very complex insulin schedules include an insulin pump. Here we have a picture of an insulin pump. There is a subcutaneous needle that is directly inserted into the fat tissue of the abdomen. The patient programs the pump to deliver a continuous infusion of insulin subcutaneously, and the patient can be taught to adjust the basal rate and bolus doses for cases of hyperglycemia, or actually decrease the dose of insulin in the case of exercise. The insulin pump requires frequent self-monitoring of blood glucose, and the patient may need to check their blood glucose at least 4 times a day. It also requires meticulous care of the equipment. Advantages of the pump include greater flexibility in the meal timing and the content of the meal, and improved control of blood glucose levels. However, insulin pumps are not for everyone. The disadvantages include the danger of rapid development of diabetic ketoacidosis if the flow of insulin is interrupted or the pump is not properly programmed. They may also be at higher risk for skin infections at the infusion site. In the past, purified preparations of insulin were derived from beef and pork pancreas. Today, insulin is manufactured to replicate human insulin, and this is done by genetically modifying yeast or E. coli to produce the hormone. All insulin preparations begin as regular insulin as its base. That is the short-acting insulin. Additives can be added to affect the timing of the release of insulin. And additives can also cause allergic reaction at the injection site. Insulin types include rapid-acting insulin, called Lispro, short-acting insulin, called regular insulin, which is used in the sliding scale, intermediate insulin is NPH, and long-acting insulin, such as Lantus. Other insulin preparations include 70% NPH and 30% regular. An insulin sliding scale is determined by the blood glucose level. The sugar is checked before meals and at bedtime, and insulin is given based on the blood glucose. 200 to 250 requires 2 units of regular insulin in this example. If the blood sugar is 251 to 300, then 4 units of regular insulin would be given, and so on and so forth. It is important to know that you need to call the physician if the blood glucose is greater than 450. So insulin must be injected subcutaneously with an insulin syringe, a pump, or a metered dose pen injector.